Healthy babies and family planning are important to all of us. You must do everything you can to ensure that a child makes it safely through childhood, said Mary Breckinridge. But along the way, you must take care of the rest of their family.
So if you take as your focus the young child, you find it leads you into a broad preventive public health program. You find it leads you into families, into every kind of situation.
Mary Carson Breckinridge was born in 1881 into a prominent family with deep Kentucky and political roots. The deaths of her own children had a profound effect on her life and led her to devote the rest of her life to improving the lives and health of children. World War I ended but left France devastated, and conditions for women and children remained especially hard. By 1919, Mary Breckinridge had joined the American Committee for Devastated France. Her assignment? To help those who were starving in French villages, a task that would strongly shape her resolve, her purpose, and her future. Back home in Kentucky, progressive reforms had improved the lives of women and children, especially in America's cities. But children in remotely rural regions had been neglected. While in France, she was exposed to both the French midwives trained only in midwifery and to British nurse-midwives who were trained as both public health nurses and midwives.
I discovered among my English friends that the nurses had taken postgraduate training as midwives and were nurse midwives. Well, that was the answer to the rural problem.
In the summer of 1923, Mary Breckinridge rode 650 miles on horses and mules through the mountains of eastern Kentucky, assessing the state of care for women and babies.
My cousin Mary Breckinridge had founded the Frontier Nursing Service in 1925, and she asked me if I would study cinematography in New York, where I lived, and come down and make a film for her to help publicize the work. And Cousin Mary was deciding where to start her work in rural nursing and midwifery. She thought of her native state of Kentucky, and she thought if she could show that you could give good care to people who live in modest cabins, far from any towns or cities, that it could be done anywhere. She had an idea of the beauty of the country and the integrity and decency of the mountain people, and she thought that would be a good place to start her work.
In time, 6 rural clinics and a small hospital were opened. But the Great Depression led to great difficulties. Supplies were scarce. National legislators could understand why textiles were needed for diapers, but Breckinridge often found it hard to convince them that horseshoes were essential to safe childbirth. Most of the nurse midwives were recruited from England, as there were no schools of nurse midwifery in the United States. As World War II began, the service faced increasing challenges as the British nurse midwives returned to England to be with their families and to help the war effort in their own country. To fill the growing need for nurse midwives, a school was opened in 1939 at Hyden Hospital. Despite challenges, Mary's vision and plan continued to grow. Frontier nurses and midwives rode horseback over mountains, through creeks, and up hollers to get to their patients in snow and in rain. In time, jeeps were used for transportation.
In 1954, the Frontier Nursing Service assisted with the birth of their 10,000th baby, a beautiful little girl, Marlene Wooten.
Symbolic of Mary Breckinridge's achievements is this newborn in a saddlebag. Today, the influence and voice of Mary Breckinridge continues. Babies and families are well served, with programs to nurses in rural and underserved communities throughout America and in many foreign countries, services that far exceed anything Mary Breckinridge could have imagined.